When you see the picture of this girl, what instantly comes to mind? A bubbly, happy teenager? Well, her name was Amelia Butlin, 19 years old, first year at university. She was kind, smart, loved by her family, and surrounded by friends. But behind that smile, she battled ADHD, depression, and anxiety all alone. After the pandemic, she found it impossible for her to separate herself from social media platforms on her phone. And just last year, in October, Amelia died by suicide. Now, this is just one sad story out of millions. But I can't help but ask myself, what if Amelia had received the right help at the right time? Where would she be right now? Mental health disorders don't just exist in certain countries. They're present everywhere. And according to the World Health Organization, it is predicted that 1 in 8 people globally will experience some sort of mental health disorder at some point in their lives. Isn't that surprising? And amongst the youth, that number jumps to 12%. Tragically, 87% of people who do seek out for help in order to face these mental health challenges never actually receive it. So you won't be alarmed when I say that 700,000 people every year die by suicide. That's one person every 40 seconds. And it's now become the 4th largest cause of death, especially amongst 15 to 25-year-olds. And that's predominantly caused because of poor mismanagement of mental health conditions such as depression and anxiety, much like in Amelia's case. This problem is getting worse. After the pandemic, it caused a spike of 25%, especially in depression and anxiety levels. So this isn't just a personal issue anymore. It's a public health emergency. My name is Riya Mehra, and I love finding solutions to real-world problems. I believe that by leveraging the use of artificial intelligence, or AI, it can prove to have a significant breakthrough in addressing global problems such as mental health disorders. But this will be done not by replacing people, but by stepping in where people just cannot, at 2 a.m., at home, all alone, in the shame, in the silence, in the fear, in the presence of phobias of not being able to express yourself to therapists, specialists, because you're scared of being judged back. So let's take a look at what actually causes this crisis. Mental health disorders are caused by multitudinous factors, but the most common ones being stress, social media, pressure, peer pressure, loneliness, isolation, and trauma. But I think that there's one thread that connects all these knots together, and that's the lack of proper care. Because think about it, 85% of people don't receive help, not because they don't want it, but because there simply aren't enough trained professionals to provide it. And that's where AI can step in. So, let me ask you a question. What if the next time you felt anxious or frustrated, it wasn't a person who noticed it, but a machine or an AI? So, sounds like science fiction, right? But it's already happening. AI isn't here to replace human compassion, but rather to scale it. In a world where demand far outweighs supply, AI can be used as a bridge, not the solution, but a strong part of it. AI has the potential to help shape our lives without us actually putting in too much effort, because it has a lot of potential. So globally, there are on average 13 healthcare professionals per 10,000 people. And in low-income countries, that number drops to lower than 7. And there are these stats to prove it. But this shows us something interesting. It shows us that the demand for using AI or generative AI to help with mental health care is much higher in lesser developed countries. And why is that? Because the need is urgent and the resources limited. These numbers create a story, one that hits home. From a young age, I grew up with someone who was very close to my heart and someone who I watched struggle in silence, my aunt. She battled depression and anxiety. She has felt miserable day after day, year after year for almost 8 years now. That's almost a decade gone, a decade wasted. With no help from therapists, specialists, she has become a recluse. Her voice, her pain, unheard to this day. But what hurt the most was the lack of support, the loneliness. And even more so, the fact that all this happened in less than 6 months. She developed the symptoms, and boom, just like a domino, she crumbled. I now wonder how AI could have been utilized and adapted to help Amelia's situation, my aunt's situation, and countless others who face the same. What if she had a voice in her pocket? What if Amelia had a voice in her pocket? Not a friend, a helpline, but a voice. A non-judgmental presence, always there, always listening. So, AI isn't just a futuristic idea. It's already being used in countless ways, such as voice pattern recognition, detecting emotional shifts, and even flagging high-risk behavior. Imagine AI technology as a second set of ears that picks out key information, subtle clues that even trained clinicians might overlook. AI has the potential to redefine our understanding and diagnosis strategies of mental health illnesses, something that may be difficult for some clinicians to do as well. AI-powered deep neural networks can be utilized, trained using huge data sets to analyze language patterns in real time, used in therapy sessions wherein a therapy audio or a conversation is fed into the algorithm and it generates a unique therapy barcode, much like the one on the screen. This serves as a visual summary of the emotional trends and recurring mental health concerns that have been flagged up by the algorithm. So for example, anxiety spikes, self-doubt, and even a hopeful tone can be picked up. Supervised and unsupervised machine learning algorithms can also be utilized to identify a person's predisposition to certain diseases, and that can enable earlier intervention and prevention. So, all in all, AI can be used as a digital, private, judgment-free chatbot that maps emotions, catches out warning signs, and even supports the user by providing them with strategic ways to cope with stress, allowing them to calm down whenever needed, offering 24/7 support when times of crisis are being faced. Let's take Wysa, for example. It's an AI-powered chatbot. It uses cognitive behavioral therapy to analyze the user's emotions, allows them to calm down when working in stressful conditions, having problems at home. It allows the user to take a breath, tells them to breathe in and out during a panic attack. It never sleeps. It never interrupts. It's always there. It allows the user to reflect, to journal, to sleep better. But the AI-powered support itself doesn't sleep. So let's take a scenario. A 15-year-old girl. She's anxious, alone. She doesn't have anyone to talk to, but she has a phone. And on that phone is an app, an AI-powered chatbot. That chatbot, like I said, doesn't sleep. That chatbot doesn't discriminate. And she always has access to it. And for the first time, that girl feels heard. This moment could be the difference between despair and survival. That girl now feels rejuvenated, like she has a second chance at life. So let me ask you again. What if the next time you or someone you loved felt anxious, frustrated, it wasn't a person who noticed it, but an AI, a chatbot, a digital ally that noticed it first? Let us not see AI as a replacement, but rather as a pattern that analyzes our emotional trends and uses it to get better, to help us better. A partner. AI can be the first responder in times of crisis for millions of people. And if we use it the right way, AI, without a doubt, will not just improve mental health care, but it will save lives. Thank you.
Thank you, Riya.